Yeah, absolutely. One other thing I just want to bring up for viewers and listeners who may not be familiar with these things, and you may be, George, I'm sure, but for our nonverbal loved ones that aren't able or have a hard time verbalizing their needs or what they're feeling, there's wonderful cue boards that you can get on Amazon for just a few dollars that will have like facial emojis. There'll be a pain scale, and you can either point for them and watch their visual cues for their response, or if they're able to point, and then that's another good method for helping to communicate how they're feeling and what they're experiencing if they're not able to verbalize it.
And that's why I love this show, because it's not just about one thing. It's about everybody, that we have to be a family in the fight for all these diseases, whether it's dementia, Alzheimer's. Just last night, my wife and I attended a kind of charity event for the United States Holocaust Museum. And as we were there, this young woman next to me who invited us, I don't get out much, everyone, because I'm always working and advocating, but she just told us her husband has ALS. And it was tough to hear. They're young too. They're in their probably 49, 50s.
Mm.
And the whole night conversation turned on caregiving, because she's just mentally trying to prepare. She even read my book on my mother's journey, and she knew my mother well.
Okay.
She was my mother's banker for 20 years. So it's not easy to prepare for the world of caregiving, but she is trying to do some due diligence, but talking to others and communicating like we did, I hope put her in a little bit more of a safe place. And we offered obviously to come here to our home or anywhere thing we can do to help. But Lou Gehrig's disease is another area. Maybe someday, if we want in the future, we could do full shows just on each disorder or
Yeah.
disease, because I think it's unfortunately there's so many that will be doing this for 30, 40 years, but I
Right.
think it'd be a great idea just because there's not enough awareness for all of these things.